The Km value indicate A. Affinity, B. Purity of enzyme, C. Half-life enzyme drug complex, and D. Physiological role. And the answer is C part, half-life enzyme drug complex. Km is a plasma concentration at which elimination rate is half maximal. And the second question is, a combination of ampicillin and gentamicin is an example of A. Bacterial symbiosis, B. Synergy, C. Indifference, and D. Antagonism. And the answer is B part, synergy. Next question, idiosyncrasies is known to have A part psychological component, B physiological component, C genetic component, and D nutritional component. And the answer is C part, genetic component. Idiosyncrasy is genetically determined abnormal reactivity to a chemical. And the fourth question is, immune mediated qualitative drug intolerance is called A. Supersensitivity, B. Hypersensitivity, C. Hyperacidity, D. Idiosyncrasies. And the answer is hypersensitivity. Hypersensitivity also called allergy. The drug with extensive first pass metabolism, A. Digoxin, B. propranolol, C. chlorpromazine, and D. quinidine. And the answer is B part, propranolol. And the next sixth question is, the phase 1 reaction of drug metabolism include the following except A part oxidation, B part hydrolysis, C conjugation, and D reduction. And the answer is C part, conjugation. Phase 1 reaction of drug metabolism include oxidation, reduction, hydrolysis, cyclization, and decyclization, while phase 2 include conjugation, acetylation, and methylation. Next question 7. Neuroadaptation to drug is same as A. Psychological dependence, B. Physical dependence, C. Habituation, D. Addiction. And the answer is B part, physical dependence. Next question 8 part. Loading dose depend upon A. half-life, B. rate of administration, C. clearance, and D. volume of distribution. And the answer is D part, volume of distribution. If volume of distribution is more, it means more amount of drug is in the tissue and less in the plasma. So require higher doses to achieve a particular plasma concentration. Next 9. Least predictable reaction to drug. A. allergy, B. toxicity, C. idiosyncrasy, D. side effect. And the answer is C. idiosyncrasy. Idiosyncrasy is a genetically determined abnormal reactivity to a chemical. So it is most unpredictable. Next 10. Following drug which undergo most of its metabolism pre-systemically. A. verapamil, B. salbutamol, C. paracetamol, D. propranolol. And the answer is D. propranolol. Propranolol undergo extensive first pass metabolism in liver. And 11. Allergic reaction depend upon all except A. antigen antibody reaction, B. previous exposure to drug, C. pharmacological action of drug, and D. dosage of drug received. And the answer is D. dosage of drug received. 11 question, which is a prodrug? A. clonidine, B. acetazolamide, C. enalapril, and D. salmeterol. And the answer is C part, enalapril. Next question 13. Therapeutic index indicate A. drug safety, B. drug toxicity, C. drug potency, and D. drug lethal effect. And the answer is A part, drug safety. It is a ratio of median lethal dose to the median effective dose. And the 14th question, a prodrug is A part, a drug that is stored in body tissue and is then gradually released in the reaction. B part, an inactive drug that is transformed in the body to an active metabolite. C part, the oldest member of class of drug D part the prototype member of class of drug, and the answer is B part an inactive drug that is transformed in the body to an active metabolite. 15th question, majority of drugs are transported across the membrane by A part passive diffusion, B facilitated transport, C active transport, D filtration. And the answer is A part passive diffusion. Next 16 question, drug exhibiting first pass metabolism are all except one. A salicylates, B propranolol, C nitroglycerin, and D morphine, and the answer is A part salicylates. Next 17 question, teratogenicity results when drugs are given during A soon after birth, B first trimester, C second trimester, D third trimester, and the answer is B part first trimester. The first trimester is the most vulnerable period for teratogenicity. 18 question, IV anesthesia is A naloxone, B flumazenil, C sevoflurane, D propofol, and the answer is D part propofol. And the next question is secretory immunoglobulin is immunoglobulin A, B immunoglobulin E, C immunoglobulin G, and D part immunoglobulin M, and the answer is A part immunoglobulin A. Next question, 20 question, hepatic first pass metabolism is important in A drug given IV, B drug given IM, C drug given orally, D none of the above, and the answer is drug taken orally. First pass metabolism refer to metabolism of drug during its passage from site of absorption into systemic circulation. 21st question, during administration of NSAID in children, the most important dose administration is A age of child, B weight of child, C chronicity of pain, and D nature of drug, and the answer is B part weight of child. Next question, 22 question, elimination after 4 half-life in first order kinetic is A part 4.75%, B 80.5%, C 84%, D 93%, and the answer is D part 93%. In first half-life 50% of drug is eliminated, in second half-life 75% drug is eliminated, in third half-life total 87.5% drug is eliminated, and in fourth half-life total 93% drug is eliminated. So answer is D part 93%. So 23rd question, if patient suffering from X aggravated effect of pharmacological effect, A part side effect, B part toxicity, C part idiosyncrasy, and D part none of the above, and the answer is B part toxicity. 24th question, which drug had high first pass effect? A disopiamide, B amiodarone, C phenytoin, and C phenytoin, D verapamil, and the answer is D part verapamil. Propranolol, alpranolol, verapamil, and salbutamol are the drug with high first pass metabolism. Next question, 25. All of the following increases drug metabolism by activating cytochrome enzyme except A rifampicin, B tetracycline, C cimetidine, and D phenobarbital, and the answer is C part cimetidine. Drug given sublingually. And 26, drug showing zero order kinetics of elimination. A part show a plot of drug concentration versus time that is linear. B are more common than first order kinetic. C have a half-life dependent of dose, D. Decrease in concentration exponentially with time. And the answer is C part, have a half-life dependent of dose. And 27 question, complete drug elimination occur after how many hours? If T half is 4 hours. A part 30 hours, B 12 hours, C 25 hours, and D part is 20 hours. And the answer is D part, 20 hours. 20 hours. Next question, 28. The ratio of median lethal dose to the median effective dose is A. Anesthetic ratio, B. Morbidity index, C. Mortality index, and D. Therapeutic index. And the answer is D part, therapeutic index. 29. When allergic manifestation occur pursuant to the use of antimicrobial agent, which of following is seen? A. Serum imbalance, B. Skin eruptions, C. Angioneurotic edema, and D. Sialorrhea. And the answer is B part, skin eruption, and C. Angioneurotic edema. Next question, what is the advantage of sublingual route of administration of drug? A part can be spitted out with a sign of toxicity, B. Lipid soluble, C. Easy to administer, D. Prevent or bypass first pass metabolism. And the answer is D part, prevents question number, I think 30. Prevent or bypass first pass metabolism. So answer is D part, prevent or bypass first pass metabolism. And 31 question, therapeutic index is A part LD 100 over ED 100, B part ED 50 over LD 50, and C part LD 50 over LD ED 50, and D part ED 100 over LD 100. And the answer is LD 50 over ED 50, because LD 50 means median lethal dose over median effective dose. 32. The drug which crosses placental barrier is A. corticosteroid, B. diazepam, C. phenytoin, and D. all of the above. And the answer is D part, all of the above. Next question, 33. For arsenic poisoning antidote is A. EDTA, B. penicillamine, C. BAL, and D. dexferoxamine. And the answer is BAL, British anti-lewisite agent for arsenic poisoning. 34. All of the following statement regarding all of the following statement regarding bioavailability of drug are true except A. Bioavailability of an orally administered drug can be calculated by comparing the area under cure after oral and intravenous administration. B. Low oral bioavailability always and necessarily means poor absorption. C. Bioavailability can be determined from plasma concentration or urinary excretion data. And D. It is absorption of unchanged drug that reaches the systemic circulation. And the answer is B part, low oral bioavailability always and necessarily means poor absorption. And the 35th question, intramuscular route is precluded during the medication of A. antifibrinolytics, B. anticoagulants, C. antidiabetics, C. antihypertensive. And the answer is B part, anticoagulant. And सॉरी फॉर एक्चुअली हैंग हो रहा है मेरा फोन. नेक्स्ट इज plasma concentration of drug at time 0 is 96 gram per ml. If our concentration of plasma at 10 hour will be A part 3, B 12, C 24, and D part 48. And the answer is A part 3, because 0 to 10 hour means it has 5 half-life. So it has answer is 3. Zero order kinetic is seen with A. digoxin, B. phenytoin, C. phenobarbital, and D. erythromycin. And the answer is phenytoin. And the 38th question, drug efficacy refers to a therapeutic index of drug, the range of disease in which drug is beneficial, C. maximal intensity of response that can be produced by drug, and D. therapeutic dose range of drug. And the answer is C. maximal intensity of response that can be produced by drug. Thank you.